Hello everybody, my name is Rachel Hopkins. I am a graduate student at Indiana State University working on my master's degree in nursing education. So I'm going to do a quick video for you guys today. This is going to be over the Alaris pump. Before we get started, of course, you're always going to want to just verify the patient's name and whole social security number. That's here at the VA. Those are the two identifiers that you always want to check. And you're going to check the, just make sure that it's the right medication, right dose, right time, right route. So the first thing is there's a system on button here. After you have your IV tubing primed and ready to go, you're going to hit that on button. There we go. It's going to run some self-checks. Okay, so this is saying replace the battery. I just plugged this in, so you're going to hit confirm, and then it's ready to go. So this says, is this a new patient? You're going to hit yes. And then the next thing that's going to come up is which area that you're in. So you're going to hit the appropriate button for that. You're going to hit yes. Okay, so the first thing is you're going to go to this channel select. This right here is side A, and you can see the A right here and the A on this side as well. So you're going to hit channel select. And then you have a infusion menu, which would be the drug menu, the IV fluids, or the basic infusion. For the most part, you're always going to use the drug menu or the IV fluids. So for this particular thing, we're going to pick the IV fluids. You have several different choices on what type of IV fluids that you can choose. We're just going to do a maintenance. And then it asks you, you've selected maintenance, is this correct? Yes. All right, so at this point here, it asks you for the rate. And we're just going to say 200 an hour. And then the next one is volume to be infused. And so you're going to go up here, you're going to look at your IV fluids. This happens to be a 250 ml bag. So we want 250 to be infused. Okay, and then at this point, you're ready to start. Grab this so we don't make a mess here. Just 1 second. Okay. Before you hit the start button, you want to load it though. So on this, you have a little cartridge here. That's going to go straight in. This fits right up there. Close it. Now you're going to hit start. And that's all there is to that. Okay, let's see here. So we're going to turn it off again, because this time we're going to do a secondary infusion. So this would be, say, if you have IV fluids going and then you get an order for an antibiotic. So what you would do is we have a secondary tubing set. You can tell it's much shorter than the regular tubing line here. Again, I've primed it to make sure it's ready to go, and then I have the roller clamped down. So we're going to go back to on. Just going back through the same steps that we just went through. So I'm just doing my primary right here. Okay. so you're going to go back to your channel select. You have a series of things that you can choose from down here. We're going to hit the secondary. So this beeping is letting me know that I did not unroll the clamp here. It's saying occluded. So we're going to restart. Make sure it's going here. Okay. We're back to the secondary. Alright, it's a good thing you guys are seeing this. It's saying error in line. So what I'm going to have to do from this point button here. You don't want to do that. Okay, so now we're going to go back through and I'm just going to trace the line down. Obviously it's not hooked up to the patient at this point. And you're just going to kind of follow it through here. You're looking for any air bubbles. Which I'm not seeing any. Oh, there's one. Yep, there's a little one. It was right down here. Okay, so I just let it run through, make sure it's good and flushed. There's nothing in there. Okay. I think at this point we've gotten everything. Just want to make sure here. Okay. Restarted it. Back to the secondary again. Okay, so I'm going to channel select, hit secondary. Sometimes these pumps are finicky. Let's see here. Once again, it's saying there's an error in line. I do not see anything, but of course we want to make sure. Sometimes it helps if it continues to do that, to flick it a couple times right up here in the area that fits in between this cartridge right there. Sometimes that helps. It's really just troubleshooting it. I don't see anything here. Okay, let's try it again. Alright, let's see, hopefully that works. So basically all I'm doing is I'm going back through the steps. So we're going to go back to the secondary again. So this, you can see there is many different medications in this library that's already programmed in for us. So there's a page down button here. You're going to page down until you find which medication you want. For just this particular scenario, we're just going to say that it's azithromycin. And then you have your option. There's 2 different dosages in here, so you're going to just verify which dosage you have. So we'll just say the 500 milligrams per 250 ml. And then it's going to you're just going to verify this, so you're going to hit yes. So here's the thing with this. You're going to, whenever you do a secondary, your primary bag has to be hanging lower than your secondary in order for it to go in. Alright, I think this is beeping at me because I just put in very little fluids to be infused. I didn't want to run out on this before we were done. Okay, so it's saying 500 milligrams per 250 ml. Is this right? It is. You're going to take your alcohol swab. You're going to clean the hub with that. Then you're going to hook in. Alright, so now we're hooked in here. You can tell I'm at this proximal port here, the very top one. You're going to unroll your clamp. And you're going to hit start. Okay, and so that's all there is to that. One other thing that I wanted to show you guys real quick here. I'm going to turn this off so it doesn't beep at me. Is that the great thing about these Alaris pumps is that, let's just say you didn't want to do a secondary for whatever reason. You have the option of adding channels onto this pump. So there's like a little black clip here on the side, as well as over here on this side. So all you have to do is hook on here. You just push it on and then push, and you can hear it click. To remove it, there's a little blue button. You push there and it comes right off. And so then that way you could just take another full extension tubing and plug it into there, and then you can have them both running at the same time. So just another option. Some nurses, you know, they have their different preferences. So that's about it on the Alaris pump. If you have any questions, let me know. We'll be doing a short checkoff list during clinical time. Thanks.